Namaskar. Hi, I am Dr. Jyoti Sharma. I am a homeopath by profession and I reside in India and provide online consultation all over the world and send the medicines to the given address. So today I will be discussing about kidney disease um, and cover specifically some aspects of chronic kidney disease as well, which is affecting a lot of people worldwide. So, let's cover some facts first. Kidney disease is leading cause of death in the United States and affects millions of people. Around 35.5 million US adults have chronic kidney disease, but most of them are unaware about it, and this makes it like one out of every seven adults has this kidney disease, CKD. And when we come to people not knowing it, around 9 in 10 don't know they have it. So, as per the data, about 360 people or even more begin their treatment for kidney failure with dialysis or kidney transplant every day in the US itself. African Americans are almost four times as likely as whites to develop kidney failure. Hispanics are also at increased risk. Now, when we come to India, so the prevalence of CKD in India is estimated to be around 9.94% to 17.2%. It varies according to the range, and the states in India which are largely affected by CKD or are considered as hotspots of CKD for CKD are Andhra Pradesh, Maharashtra, Orissa, and Puducherry. So yeah, there are large number of people suffering from this disease, and let's talk about the risk factors. So, as the people who are already suffering from it most likely know it, diabetes and high blood pressure are basically the two leading causes of kidney failure, and they account for two out of three new cases. There are also other causes or risk factors that can lead to kidney disease, acute kidney disease, chronic kidney disease, and they include heart disease, obesity, family history of kidney failure, and being age 60 or older. And sometimes kidney defects at birth can lead to kidney diseases for life. So that can also affect sometimes kidney stones. Repeated kidney stones can be your reason for kidney disease, and any medication that has not been prescribed to you but you have taken, or that might have been prescribed to you and it has affected you in the bad way, can damage your kidneys. So yes, any of them can be a cause for kidney disease in a person, but the uh, important thing which have to be kept in mind is um, include hypertension and diabetes. Also, anemia and definitely being overweight or obese can also be considered as risk factors for kidney disease. When we come to signs and symptoms of CKD, they can be really non-specific. You might not be able to judge it that it is a serious disease that you are progressing into, because the symptoms may be so vague and initially so not challenging. uh, you might find them manageable. So yes, there can be symptoms. Some kidney infections may be present, some urine infections may be present, that can be risk factors as well as develop as symptoms of the kidney disease, and they might be really vague. So also, increase in the frequency of urination may be there in some patients. Mm. Or there might be little urination in some patients. So basically there may be changes in urination, depends from patient to patient. Then there may be swelling of the feet and ankles, Pitting edema may be present. Like pitting edema means when you press on your ankle and there develops a pit or a hollow thing, and it lasts for around 60 seconds or more. So that is basically pitting edema that may be present. And itching all over the body, muscle twitches, chest pain, shortness of breath, and foamy or bloody urine, that is blood in urine, may be present. Now this makes it so fast, nobody, like if you have chest pain, you might not suspect that it might be a kidney disease, but that's why you need to go to a doctor to get your tests done and get it diagnosed early. So yeah, weakness may be there, tiredness may be there, pain in lower back, muscle cramps, nausea, vomiting, loss of appetite, very general symptoms like feeling sick um, may be there. And you might not understand that they are particularly because of your kidney. So yes, that calls for routine checkups, and that calls for having your consultation booked with your doctor. So yeah, this is what you have to take care of, that whenever something is wrong in your body, something is different in your body for a time period which shouldn't be, like, ideally you should immediately go to the doctor, but even if you're giving a grace period, please do not give it more than a week, because do go and consult, otherwise it might be possible that the kidneys get completely damaged within a minute, within an hour, within a week, within a month. So ideally it should be immediately, but even if you're trying everything at home, please do not give yourself more than a week for the self treatment then you go that you do at home. So yeah, and now when we come to management, it is wide, because it also depends on the underlying disease, the underlying condition that has led to your kidney disease. Your medications might need a change. You will need to control your blood pressure, blood sugar, and take your medicines as prescribed, and your doctor might need to change your medicines. Eat a healthy diet as prescribed by your dietitian and your doctor. Exercise if you can, and you should try if you can't. uh, Maintain a healthy weight, get enough sleep, stop smoking, because smoking automatically becomes a causation, a risk factor in every disease possible. Limit your alcohol or take no alcohol at all. Manage your stress and depression, because depression and stress will automatically worsen your state. Salt should be taken in control. No to a lot of salt, and many times you are advised to drink or eat diet which is actually devoid of all salt. So yes, and in case you have already suffered from glomerular nephritis, that is kidney inflammation, or any autosomal dominant polycystic disease that might have become a risk factor for your current kidney condition, or kidney stones, or enlarged prostate, or medicines, the risk factors should be identified basically and taken into consideration. While the allopathic management depends on the allopathic doctor, that is dialysis or kidney transplant, whatever may be advised. And if you are taking allopathic treatment, do follow whatever has been advised by your doctor. Certain lifestyle changes can help um, in your condition, but what I will focus is I will focus how homeopathy can help in your condition. So basically, with gradual treatment, there would be a reduced frequency of dialysis, but that is gradually. You should not just leave your dialysis if you have already begun with it. Uh, just by starting the homeopathic treatment, just don't leave it immediately. Gradually, the doctor who is doing the dialysis will find it less necessary to advise that frequency of dialysis that you are currently on with gradual homeopathic treatment. Uh, Moreover, the underlying cause will be controlled, such as cholesterol, blood sugar control. If there is any bad effect of medicine that is leading to your current condition, gradual homeopathic treatment can help in minimizing that effect. And then if there's a familial tendency in your family, you can always take medicines in the start, as they will reduce the risk of developing CKD. Urinary frequency or urinary problems will be taken care of. Also, if there's repeated tendency for kidney stones, infections, or any toxic chemical that has caused the harm, um, that can be reduced a lot with gradual treatment. And the symptoms of the CKD, whatever particular symptoms that you have, weakness, tiredness, swelling, pain anywhere in the body, edema, they will be gradually reduced. The breath will be better gradually with the treatment. And yes, and you can always take it with your allopathic conventional treatment. um, but obviously there are some precautions that you have to take. And yes, the condition can be managed better when you take this treatment along with whatever you are taking right now. Or if you haven't begun with any of the conventional treatment and you are still at a very minimal stage, you might not need to take allopathic treatment. Once you begin with homeopathic treatment for your kidney stones or kidney infection or CKD, because your creatinine, urea, they will be in control, which you can see in your tests. In the initial stages I'm talking about, once you've already begun with dialysis, please do not leave it without the advice of your allopathic doctor. Please do not reduce the frequency of the dialysis without the advice of your allopathic doctor. When I come back to homeopathy, you can always consult me online, and I can courier your prescription, the prescribed medicines, to your given address anywhere in the world. And uh, I work to basically improve the condition of the patients that consult me. And in case you need to consult me, I will leave my email address below. You can always send it to me there. And that's it for this video. Please stay connected. Please like the video, share the video, and subscribe to the channel. And do not forget to hit the bell icon. Moreover, I will come up with such videos in English as well as in Hindi, um, so that we can share information about diseases and how homeopathy can help uh, in such diseases. Thank you so much for staying connected. Please like the video, share the video, and subscribe to the channel. And do not forget to hit the bell icon. Moreover, if you have any relative or a friend who is in need of homeopathic treatment for any kidney disease, please forward this video to him or her. Thank you so much.